Assalamu alaikum wa rahmatullahi wa barakatuhu. My name is Ruhaila Manutara Ali, and my report is meningococcemia, or you can read it as meningococcemia, which is a severe form of blood poisoning that affects the entire body. Or basically, it is a blood infection due to the bacteria that is called the Neisseria meningitis. So, meningococcemia is defined as a severe form of blood poisoning that affects the entire body. A severe form of blood poisoning that affects the entire body is also called or known as meningococcal septicemia. So, according to the World Health Organization, it is a blood infection that is due to the bacteria Neisseria meningitis. So, it can occur at any age, but babies and young children are mostly at risk. It is synonymous to meningococcal disease and meningococcemia meningitis. So, for example, halimbawa, so when someone has this disease, then this means that the bacteria enters the bloodstream and they multiply. Multiply meaning double, triple, quadruple, they multiply, which causing the damaging of the blood vessels throughout the body and causing bleeding into the skin and organs. So this can lead to significant rashes. So as you can see in this picture, these are actually rashes. So rashes are usually itchy, very red, and the irritation of the skin. So this is actually sometimes caused by irritation and allergies. So this condition often occurs alongside the meningococcal meningitis but is most likely to be fatal when it presents without it. So the hallmarks or the very hallmark sign of meningococcemia is rash or rashes that does not fade. They do not fade under pressure. So rashes that do not fade under pressure are usually a sign of what we call the meningococcemia. These rashes can appear anywhere in the body. It can be our whole body, the whole body. The can be through the hands or any part of the body where the blood vessels are damaged, which allows the blood to leak into the skin. So this disease is actually a rare infectious disease that is characterized by the upper respiratory tract infection, fever, skin rash, lesions, eye and ear problems, and possibly a sudden state of extreme physical depression, for example, the shock, which may be life-threatening without appropriate medical care. So we have two forms of this disease. We have the fulminant meningococcemia and the chronic meningococcemia. So when we say fulminant meningococcemia, it develops very rapidly. So meaning the rashes spread or they develop the signs and symptoms of this disease develops very rapidly compared to chronic meningococcemia, which has a waxing and waning course. And what is the causative agent or the bacteria of this disease? So as we mentioned, the causative agent of this disease is Neisseria meningitis, which is defined or it is often referred to as Meningococcus bacteria. So this is a gram-negative bacterium that causes meningitis and other forms of meningococcal diseases, such as the meningococcemia or the life-threatening sepsis. So as we have mentioned earlier, it is an infection in the blood, or as defined by the WHO or World Health Organization, it is a blood infection due to the bacteria of this what we call the Neisseria meningitis. So that is usually found in the nose and throat without causing diseases. So this bacteria causes meningococcal disease, as we have mentioned. Actually about 1 to 10 people, isa sa 10 tao, have this bacteria in the back of their nose and throat without being ill. So this is called being a carrier. Sometimes these bacteria invade the body and causes certain illnesses, which are known as meningococcal diseases. That includes the meningococcemia. So this bacteria is a common member of the normal microbiota in the upper respiratory tracts of up to 40% of healthy people, and as a result of this crowded living conditions, meningococci or meningococcus bacteria are more common in children and young adults from lower economic groups. That is why, sa sinabi natin kanina, most at-risk people are the babies, children, and young adults. So, ano ba yung mode of transmission or paano nahahawa ang isang tao sa ganitong kind of disease? So, what is the mode of transmission? So, we have the airborne disease. So, this includes the coughing, sneezing, kissing, sharing cutlery or food, sharing drinks by the same container, and sharing lipstick, cigarettes, and toothbrush. So as you have observed, kung makikita niyo sa mga mode of transmission ng meningococcemia disease, so most karamihan sa kanila, for example, kissing, sharing, they are most likely having close contact with one person to another. And we have first the coughing. This is ito yung pag-ubo, and sneezing, the sudden outburst of air from the nose. And then kissing. This is an example of the lengthy close contact to someone. So this is common to couples. And then sharing cutlery or food, sharing drink by the same container, sharing lipsticks, cigarettes, and toothbrush. So sharing is very common to peer friends, family members. So it is very advisable that if you have this kind of disease, meningococcemia, it is important that you separate your things, specifically yung mga bagay na you know, that you are aware that is can cause disease to other person. So basically you have to distance yourself from them so that you cannot harm them or cause them disease. And then the incubation period. So typically 3 to 4 days, 3 to 4 days with a range of 1 to 2 days. So meaning to say, what we symptoms appear usually from 3 to 4 days, tatlong hanggang sa 4 na araw, after the person is infected. So it can take up to about 10 days, a range of 1 to 10 days, to fully develop symptoms. So these symptoms include a sudden high fever. So high fever meaning the body temperature of the person is above normal or may have reached the 40 degrees Celsius or more. And then we have the clinical manifestations, signs and symptoms, pathognomonic signs. So these are the few signs and symptoms of the meningococcemia disease. So we have first the fever, and then fever yung lagnat, stiff neck, pananakit ng leeg natin. Like for example, kapag hindi natin move yung leg natin, and then headache, pananakit ng ulo. So headache is usually kapag we think a lot, we're stressed out, we were exposed to sun for a very long time, long period of hours, and then confusion, anxiety, confusion, increased sensitivity to light, nausea, and then vomiting. Then we have here the other signs and symptoms of the meningococcemia. So we have first the fever and chilling. So the chilling is spelling CHILLING. So fever and chilling is yung pag lagnat, and then we feel so cold. The body temperature is above normal. And then we have here the fatigue or feeling tired. Like for example, kapag sobrang pagod na tayo, and we feel like hindi na natin kayang bumangon, we feel so less energized, wala tayong energy. For example, we have no longer have this urge to ourselves to do or perform our activities. Fatigue, feeling tired, feeling bored, feel like you don't want to do anything. And then we have the vomiting. Vomiting yung pagsusuka ng mga kinain natin, or when we feel like we ate something that we are not so fond of and we vomit them. We vomit the foods that we're allergic of, and then followed by the having cold hands and feet too. Pandalamig ng mga kamay natin, and then yung mga paa natin. And then we have the muscle aches. So when we feel severe aches and pain in the muscles, chest, joints. So basically having this feeling of pain all over our body. And then we have the rapid breathing. So from the word itself, rapid breathing, this means that we breathe rapidly and heavily. And then we have here the diarrhea. So diarrhea is nangyayari yan kapag sumasakit yung tiyan natin, or when we feel like going to the comfort room because we feel so uncomfortable that we have to excrete the things or objects that we have to excrete. Diarrhea. Sometimes we are experiencing cold sweats, panlalamig sa katawan, and having a stomach pain, abdominal pain. And then we have here the dark purple rash, or basically rashes. So this is what we mentioned earlier, the hallmark sign of meningococcemia. So when you have this severe rashes all over your entire body, that means you are having or you are experiencing, or you are having this meningococcemia disease. So basically, if you also have the other signs and symptoms, then you have to consult a doctor earlier, so that para maagapan agad, and you won't be experiencing this rare infectious disease kasi baka makahawa ka pa ng ibang tao. So better to consult a doctor so that they can assess you and provide you some medication or treat you as soon as possible. So the signs and symptoms that I have mentioned, so if you are experiencing those or a few of these symptoms, then it is very advisable that you consult a doctor or inform your parents so that they could take action or provide solution to that. So para rin to makaiwas sa transfer, paghawa sa ibang tao. So it is better also that if you feel like you are having this disease, meningococcemia, you're having these rashes all over your body, better to distance yourself and separate your things from them so that hindi nila magamit and hindi sila mahawaan ng disease na dinaranas mo. And then we have here the drug of choices. We have the ampicillin and penicillin, ceftriaxone. So meningococcemia meningococcemia is usually treated with penicillin or ampicillin. So mostly in adults, the method of the treatment of this disease is often through intravenous penicillin. So intravenous penicillin, in children, penicillin is a treatment of choice. However, other organisms must be ruled out before treatment is begun. So a range of antibiotics is used to treat meningitis, including the penicillin and ampicillin, and then ceftriaxone. So ceftriaxone is a drug of choice during epidemics and epidemics of meningococcal and pneumococcal meningitis. Again, I repeat, ceftriaxone is the drug of choice during the epidemics of meningococcal and pneumococcal meningitis. Take note of that. And then we move on to the nursing responsibilities. So this includes the disease prevention and control, and then nursing priorities in the care of the patients. So first, we have the disease and control prevention under the nursing responsibilities. So this means keeping up to date, being updated with the recommended vaccines, and so with that, so like for example, so meaning if you are updated on the recommended vaccines of meningococcemia disease, this can be the best protection of having the disease, or best prevention, self-protection to having this disease. So also maintaining healthy habits, eating habits, healthy lifestyle, like for example, getting plenty of rest and not having close contact with people who are sick, also help prevent you from having the disease, or is very best to prevent and control the transfer of the disease. And then we have these two types of vaccine of meningococcemia. So first is the meningococcal conjugate vaccines, or MenACWY vaccines, and then serogroup B meningococcal, or the MenB vaccines. So these vaccines help protect against all the three serogroups B, C, and Y of Neisseria meningitis. So like with any vaccines, meningococcal vaccines are not actually 100% very effective. So this means that may chance pa rin na someone can develop diseases after vaccination. 100% not effective, not fully effective, meaning there's still a chance. So we can say that it's 99% effective, but the other percent, or the 1% of it, can actually cause you, harm you, or does not means that it can still make you be infected with the disease. So people should know the symptoms of meningococcal disease, since early recognition and quick medical attention are extremely important. So meaning if you are aware of the symptoms of this disease, the meningococcemia, you are have the advantage na to be able to take action for as soon as possible. So if you are aware, or if you know about the symptoms, meaning madali lang sa'yo na mag-take action agad or masolusyonan agad yung the disease. So if you are aware, you are safe. If you have knowledge about the disease, you are possibly or 100% safe rather. And then we have here the nursing priorities in the care of the patients. We have first the increased cerebral perfusion. So this includes the, for example, monitoring the vital signs and neurological status of the patient, observing for any signs of increased intracranial pressure, observing for increasing restlessness, like for example, moaning and guarding behaviors. And then we have the improved body temperature. So this includes, for example, assessing for any signs of dehydration, such as having a dry mouth, sunken, sunken eyes, sunken fontanelle, low concentrated urine output, decrease temperature by performing tepid sponge bath. So tepid sponge bath is actually performed by the nurses to the patients to decrease temperature when they are having this high temperature. So maintaining adequate fluid intake as tolerated and administer antipyretics as indicated. So these are all included in improving body temperature. And then we have decreased pain. So basically, this is to lessen the pain the patient or the client is feeling. This includes a controlling environment to encourage rest for the patient, and then administer antibiotic and corticosteroid as prescribed. So to decrease feeling of pain. And then we have also the maintaining normal level of consciousness, or LOC. Or level of consciousness. So this includes, for example, assessing the level of consciousness using pediatric Glasgow Coma Scale, pediatric Glasgow GLASGOW Coma Scale, pediatric Glasgow Coma Scale, assessing for signs of cerebral edema, such as, for example, dizziness, pagkahilo, headache, having pananakit ng ulo, irregular breathing, neck pain, nausea, or vomiting. And then also administering and monitoring anticonvulsants drug levels. And then we have decreased anxiety, is basically to decrease the anxiety of the patient, the parent, the guardian. So, like for example, encouraging them to express their concerns and express those concerns and ask questions regarding the condition of the ill child. So encourage the parent also to stay with the child or visit when able, or tumawag when concerned if hospitalized. So provide information about the child's daily routines, encourage them to be involved in the care and decision making regarding the needs, and clarify any misinformation and answer questions in lay terms when parents are able to listen. Give same explanation and other staff and our physician gave regarding disease process and transmission. And then we have here the educate the caregivers and the family as well. So this, for example, includes the assessing of the knowledge of the disease and method to control and resolve the disease, the willingness and interest of the parents to implement care. Also, provide information and explanation in clear language that is very understandable. For example, using of pictures, pamphlets, videotapes, model in teaching about the disease. So, teach them about the administration of medication, including, for example, action of drugs, dosages, time, frequency, side effects, expected results, methods to give medication. And then also provide written instructions and schedule to follow and inform to administer full course of antibiotic to child. And then teach them to report elevated temperature, poor feeding or anorexia, irritability, or other changes in behavior or level of consciousness, decrease in hearing acuity. So these are all included in the educating the caregivers and family. So educating the caregivers and family is done by the physician itself or the nurses or other caregivers. Then decrease anxiety, maintain normal level of consciousness, decrease pain, maintain improve body temperature, increase cerebral perfusion, or all the nursing priorities in the care of the patients. So in conclusion, meningococcemia meningococcemia is also known as meningococcal septicemia or meningococcal septicemia. It is, according to the World Health Organization, it is a blood infection due to the bacteria Neisseria meningitis. So it is the hallmark sign of meningococcemia is rash or rashes. So when you feel like you're having rashes all over your entire body, consult the doctor so that maagapan or masolusyonan nila yung disease na possible mong dinaramdam. So meningococcemia is a very rare infectious disease. So the causative agent is the Neisseria meningitis, which is also referred to as Meningococcus bacteria. That is a gram-negative bacterium. And then we have the mode of transmission, or also referred to all in all airborne diseases. So first is coughing, sneezing, kissing, sharing cutlery or food, sharing drinks from the same container, sharing lipstick, cigarettes, or toothbrushes. So it is very advisable that if you have this meningococcemia, it is very advisable that you stop yourself from being in close contact to other people so that hindi mo sila mahawaan. So you have to prevent being near to other people when you are performing this thing. So basically you have to stop sharing cutlery, food, drinks, lipstick, cigarettes, or toothbrushes. And if you're a couple, then avoid first, control yourself from kissing because both of you will be harmed. And then we have the incubation period that is typically 3 to 4 days with a range of 1 to 10 days so that the symptoms are fully developed. So symptoms appear suddenly about 3 to 4 days after the person is infected. So it can take up to 10 days to develop the symptoms. So symptoms include the following. First, fever and chilling, fatigue or feeling tired, vomiting or nausea, cold hands and feet, severe aches or pain in the muscles, joints, chest or abdomen or belly, rapid breathing, diarrhea, or dark purple rashes. And then the drug of choice are actually ampicillin and penicillin, ceftriaxone. So as far as you can remember, ceftriaxone is the drug of choice during the epidemics of meningococcal and pneumococcal meningitis. And then we have the nursing responsibilities. That is first, disease prevention and control. That includes the keeping up to date with recommended vaccines. That is the best protection against meningococcal diseases, that is meningococcemia. And then also maintaining healthy habits, healthy lifestyle, healthy living, like getting plenty of rest and not having close contact with people who are sick is the best prevention and control. And then we have 2 types of meningococcal vaccines that is licensed in the United States. So what you have mentioned first, meningococcal conjugate MenACY vaccines, serogroup B meningococcal Men B vaccines. And then we have here the next, the nursing responsibilities. That is the nursing priorities in the care of the patient sufferers. It includes the increased cerebral perfusion. So, halimbawa nito is monitoring vital signs and neurological status, improving body temperature, or we have to assess for the signs of dehydration, such as having a dry mouth, sunken eyes, sunken fontanelle, low concentrated urine output, and then decrease pain, so basically to lessen the pain, to encourage rest, to decrease pain, and then maintain normal level of consciousness. So basically assessing for the level of consciousness, like for example dizziness, headache, irregular breathing, neck pain, nausea or vomiting, and administering and monitoring anticonvulsants drug levels. And then we have the decreased anxiety as well, which basically means encouraging the client or the patient to express their concerns and ask questions regarding their condition, so that they are aware and they are more relaxed and informed of their condition to decrease anxiety. And then we have educate the caregivers and family. This is basically to inform them about the disease, or to encourage them to know about the disease so that they can help with the treatment, decision making. And this is basically done by the physician, mostly physicians and nurses as well. And that would be all. Thank you for watching and listening for this video, and I hope you have learned a lot, something about this video. Thank you again. Wassalam.